I've been told countless times in my life that you have this many months to live. There's nothing we could do, no matter what. My name is Dustan Colyer. I'm 19 years old, and 13 years ago, I was diagnosed with stage 5 Wilms tumor kidney cancer.
Dustan has the most common type of kidney tumor called Wilms tumor. And while most patients with Wilms tumor get cured with chemotherapy, surgery, and radiation, Dustin's been fighting this thing for
13 years of his 19-year life.
When I was 6, I'd look around and I'd see a bunch of kids with hair, and I didn't have it, you know?
When Dustin was first diagnosed, we didn't know anybody whose child had cancer, and now we know way too many, and way too many have passed away because of it.
And my parents actually were told one day that I wasn't going to live through the night.
I can't even tell you how many times we watched him struggle to breathe.
A chaplain actually came in and blessed me into heaven, and my parents had the choice to pull the plug on me.
He lost his fingernails, his toenails, obviously all of his hair.
And I actually was put into a coma for 3 months.
It's hard and it's terrible and it's hell to watch your child suffer.
one of the core essence of oncology, and especially for pediatric oncology, is you know and see these patients for weeks on, months and years on. And some of these patients that I've followed for 5, 10, 15 years. And so they're just not a number or a patient to you.
I guess you could say, like, my doctors have almost become like family members for me.
And so you become part of their family, and you clearly are living some of the fears that the family lives through. Is this tumor going to come back, or what's going to happen? And it is personal at many levels.
My doctors in Ann Arbor have always found new treatment, new experimental drugs, things that we can just try.
So this is really technology of the future that we're now applying today. Our technologies are really meant to understand what changed in an individual's genome from the genome that they were born with to what actually was altered in the cancer. So in the case of Dustan, I think we did a pretty good job in figuring out what are the mutations that are likely causing his disease.
Once the results and the sequencing part is completed, the results are discussed in a tumor board.
We're actually one of the first sites in the country to introduce this concept of precision medicine tumor boards.
And you really are asking opinion of all these experts in the bioinformatics group, bioethics group, geneticists, adult oncologists, pediatric oncologists, pathologists, radiation oncologists. You're putting everybody's mind together.
So Dustan's case was presented at our precision medicine tumor board.
And based on that, we put him on an experimental trial in July 2013. And within a month, his tumor shrunk more than 70%. And since that time, he has been in what we call very good partial remission and has been doing exceedingly well. He's completely off pain medications, so much so that he's actually now helping other kids.
We show all the kids that they don't have to grow up, you know, they can still be a kid and still fight cancer. We give them a huge care package. We also give them a dream day, whatever it ties into their life, just so that they can get out of the environment of cancer.
And I just can't imagine any of this thing possible without the sequencing study and the phase 1 trial that we were able to give him.
Every day is a gift.
I've never even thought about giving up.
We're not just doing the research for the sake of doing the research. We want to make sure that we really cross the finish line.
Doctors alone cannot do it. You talk about doctors, the nurses, all the healthcare providers, but you need support from everybody. But people have to be aware how big a problem childhood cancer is.
now where do you want me to go from here? Because like I'd really like to make it more positive, you know?